Hello, everyone. My name is Jad, and I'm a nurse here in Houston, Texas. Nursing school can be super hard, and I struggled through nursing school, but I learned a lot from nursing school. However, I wish I had, the resources and these guides that I made when I was in nursing school because it really narrows it down, and you don't have to really study the whole book from page 1 to page 3000 just to get to pass a test or wherever. It's more about what you understand and what can you understand. So today I'm just going to talk about the cardiovascular disruptions. And first we're going to start with the ineffective endocarditis. Basically, when you look at that, you need to break down the word. If it's big, you need to break it down. For example, ineffective endocarditis, right? So we know anything that ends with the itis, that means it's an inflammation. And endo, we know it's inside, and card refers to cardio, so inflammation of the inner lining of the heart and valves. Most likely, usually, if it's an untreated strep throat or a staph, that could cause an infective endocarditis if it's not treated well. Some signs and symptoms on what you will find in your assessment is like fever, weight loss, systolic murmur, petechiae, splinter hemorrhage in the nail beds. You have 3 specific ones to endocarditis, and that will be Osler's nodes, which is like a red tender lesion in the pad of the fingers, hands, and toes. You have the Genaway lesions, which is basically non-tender lesions in the fingers, toes, and nose. And you have also the Ross spots, which is hemorrhages in the eye. So let's talk about some diagnostics, and that will be, let me just take that off, and that will be mostly, for example, history, if they have it. You can do lab tests, for example, look up CBC with differential blood cultures and a PCR and a reactive protein, which is CRP. You can do an echocardiography, chest x-ray, and EKGs. Also a heart catheterization, but we do that at the end. Some complications that you might find is the most important ones are 2. The emboli in the left side of the heart. What does that mean? That means it's going to the rest of the body. You want to make sure you monitor the LOC, and you have the emboli on the right, which is basically the lungs. You make sure you know the signs and symptoms. Some treatments, prophylactic antibiotics treatment. For certain dental procedures, respiratory tract incisions, tonsillectomy, you need to take some prophylactic antibiotics before you do these. Accurate identification of the organism. IV antibiotics for long term, usually 4 to 6 weeks. Valve replacement if needed. Antipyretics, fluids, rest, and monitor the situation. See how it goes. Some teaching, you stress the need to avoid infectious people. You want to avoid any stress and fatigue. You want to rest, hygiene, and you want to make sure you take your antibiotics. No nail biting, body piercing, or tattoos, because these can higher chance of getting the infections. Signs and symptoms, you make sure you monitor these signs and symptoms after you start the treatment. And some nursing interventions, basically you want to monitor for any embolic episodes, for example, like for spleen, renal, brain. For spleen embolic, you want to usually radiate to the abdominal pain that goes to the left shoulder, because you know how it's spleen. Renal, you get flank pain in the groin with a possible pus or blood in the urine. A brain stroke, basically changes in the neuro. Anything has to do with stroke and brain, it will come to neuro. So for example, confusion, speech difficulty, change in LOC. Pulmonary, you have chest pain, shortness, breath, and decreased oxygen saturation. And then you might mimic some signs and symptoms of heart failure. We talked about the interventions and what we do, and you want to educate your patient about, if you have a history of endocarditis, You make sure you tell any before you do any interventions, invasive interventions or surgical interventions. You want to make sure you tell them that you have a history of endocarditis, so you can take your prophylactic antibiotic before you do so. Moving on to acute pericarditis, and again, always break down the word. Peri is pericardial sac, and itis is inflammation, so inflammation of the pericardial sac. The causes of these may be infectious, fungal, or non-infectious. The infectious one will be like viral, like mumps, hepatitis, HIV, bacterial, like TB, and fungal, like histoplasma or Lyme disease. Non-infections will be like renal failure, radiation, cardiac surgeries, and all that kind of stuff. Hypersensitivity and autoimmune rheumatic fever can cause that as well. Some clinical manifestations, like signs and symptoms that you're going to see is, for example, a sharp chest pain that worsens when you're lying flat. And the pain starts aggravating by breathing, coughing, swallowing. And you have the most important one is pericardial friction rub, where it's the pericardial and the epicardial surfaces are rubbing. And how can you hear that is if you hold your breath, you would know if it's pericardial or pleural friction rub. If you hold your breath and it's still there, it's pericardial. Complications, the most important complication that you need to know is cardiac tamponade, which is basically a buildup of fluids that can go anywhere, stuck. So you'll have a chest pain, you get confused, you're restless, you have a muffled heart sounds, pulse pressure, and the pulsus paradox, which is basically a decrease in the systolic blood pressure. How do you care for these? Basically, you want to treat the underlying cause, which is basically place the patient in half flower, and lean forward. You want to administer the NSAIDs, aspirin, and corticosteroids for the pain. IV antibiotics. Want to check blood cultures frequently just to make sure. And then you want to maintain the. So now we're going to talk about myocarditis. So basically, if you break that down, myo is a muscle, carditis, heart, itis, inflammation, so inflammation of the myocardium, resulting from infection, allergic response. Some diagnostic tests that you can do is ECR, CRP, troponin. Troponin is the most important one, and you want to check the ejection fraction, and it should be between 55 and 70%. Some treatments that you can do is ACE inhibitors, beta blockers, diuretics, nitroprusside for high blood pressure as well. It reduces the afterload and improves the CO. Digoxin, you give digoxin, and then they give the anticoagulants. Before we move on, we should make sure you watch for digoxin and the signs of toxicity. For example, like abdominal pain, nausea, vomiting, high potassium, all these signs is digoxin toxicity. Oxygen, bed rest, restrict activities for these people, and then if it's super severe, like with a heart failure, you do heart transplant. And then moving on to the valvular heart diseases, which is basically mitral valve stenosis and prolapse. For mitral valve stenosis, basically it's narrowing of the valve, preventing the blood flow, primarily seen in underdeveloped countries and the ones that are at risk for AFib. People that are on Coumadin or warfarin or Lovenox, they're at risk for bleeding or stroke. The mitral valve prolapse is usually benign. It's basically an abnormality of the mitral valve that, basically what happens with that, it allows the leaflets to prolapse or buckle back into the left atrium during systole. It is the most common form of valvular heart disease in the United States. Prolapse can be misleading because it used, even when the valve is working normally, you could have it. It's usually benign, but its serious complication can occur if you don't take care of it. Although, the etiology of the MVP is unknown, there is an increased femoral incidence in some patients. You only treat the symptoms though. No preventive or antibiotics taken. You only treat the symptoms. You can diagnose it with like a 2D echocardiography or an M mode to confirm the MVP. Some characteristics is like basically a murmur from regurgitation that is louder during systole. MVP also does not alter S1 or S2 heart sounds, so that everything might sound normal and fine. You want to teach your patient, make sure when teaching the patient, the caregiver. 2. The importance of antibiotics, prophylaxis for endocarditis, because it's really important when you're like for undergoing any certain procedure. Same thing, you're gonna have to take prophylactic antibiotics. You want to instruct your patient to take drugs as prescribed. You want to advise the patient to adopt healthy habits, avoid caffeine, no alcohol intake. You want to counsel the patient who uses diet pills or over the counter to like make sure you tell your doctor about everything you take over the counter, because sometimes it could be some contraindications with it. And then how they study the valves. Basically, they diagnose the valvular heart diseases from patient's history, physical examination, various tests that I just mentioned before. An echo reveals like the valve structure, function, and the heart chamber sizes. They do a chest X-ray, EKGs, and a heart catheterization. How do you care for it? Drugs to treat or control the heart failure, vasodilators, positive intros, ceftriaxone, diuretics, beta blockers, sodium restriction, anticoagulant therapy. When it comes to valve replacement, some people do valve replacement, like a mechanical, which is artificial, or biologic, like a tissue from a real human. The mechanical will last longer. It puts you at risk for thromboembolisms, and you're going to require to take a long-term anticoagulant, which that is always a question in the test. The patient teaching, you want to teach the action and side effects of the drugs. The patient must understand the importance of prophylactic antibiotics before any, procedures or any other procedures. You want to teach them about to seek help when any manifestation of infection, heart failure, signs of bleeding, all that kind of stuff happen. And you also have the biologic tissue, which is like human, bovine, or porcine. No coagulation required. Then you jump to cardiomyopathy. Cardiomyopathy, basically, there's 3 types of cardiomyopathy, right? But I need you to focus on this one. Okay? The dilated. The dilated one is basically the most common one. It's often after the infectious myocarditis. It diffuses the inflammation and rapid degeneration of the heart fibers. Signs and symptoms could be, shortness of breath, fatigue, and will have heart failure symptoms. Diagnostics, you can do an EKG, cardiomyopathy, ECR, CRP, troponin, all these tests that I mentioned earlier. Medications, the nitrates, diuretics, ACE inhibitors, beta blockers, anticoags, and antidiuretic. And then you have the dilated interventions. Basically, you just control the heart failure because it improves the heart when it contracts, and it decreases the preload and afterload. Let's talk about heart failure. You have left-sided and right-sided heart failure, right? Remember, the left-side heart failure is always lungs, fluid overload. You don't want to give patient fluids, push your fluids, and you want to give Lasix, so you can lift up all that fluid overload out. And you have the right side, which is basically the body. It's like edema, ascites, it becomes liver failure, and make sure you know your meds. Increased blood pressure for both. That's characteristics that have both of them. If you have a right side heart failure, you're going to experience edema, like I said, the rest of the body, edema, in the legs, JVD,